Now let me tell you the guidelines for the treatment of multi-drug-resistant tuberculosis and as well as extended drug-resistant tuberculosis. Now this particular guidelines include use minimum of the 4 drugs. Okay, actually like we have extensive phase and as well as the continuation phase. In the extensive phase, like we have totally 6 drugs. Out of those 6 drugs, you have to use minimum of 4 drugs. Okay, so first point, use minimum 4 drugs. There are totally 6 drugs in extensive phase. Alright, there are totally 6 drugs, but you have to use minimum of the 4 drugs in the extensive phase. Follow the hierarchy of the drugs from class 1 through class 5. Right, we have totally 5 classes of the drugs for the treatment of MDR-TB and as well as XDR-TB, which I will discuss. But now the point is you have to follow the hierarchy of the drugs from class 1 through class 5. Alright, so follow the hierarchy from class 1 through class 5 as follows. Right, now first, the first point is that use any first line oral agent that may be effective. Right, so before that what I will do is I will tell you all the classes. There are totally 5 classes of the drugs for the treatment of MDR and as well as XDR-TB. So before telling you the hierarchy, right, I'll tell you the classes of the drugs, like all the 5 classes of the drugs. So let me tell you the classes now. So if you take class 1, right, if you take class 1, remember there are totally 5 classes. These 5 classes are for the treatment of MDR and as well as XDR tuberculosis, and these drugs are divided into 5 classes. Now if you take class 1, the class 1 is the first line oral agents. Alright, these are the first line oral agents, and these first line oral agents, they include Isoniazid, which is represented in the form of H, Rifampin, then pyrazinamide in the form of Z, and then ethambutol. So these are class 1 drugs for MDR and as well as XDR-TB, that is Isoniazid, Rifampin, pyrazinamide and ethambutol. Next, you take class 2. The class 2 drugs, they include injectable agents. Right, class 2 drugs, they include the injectable agents, and these injectable agents, they include streptomycin, then we have Kanamycin, then we have Amikacin, and then as well as Capreomycin. Right, so these are class 2 injectable agents. Next, you take class 3. Class 3 agents, these are the fluoroquinolones. Right, class 3 agents, these are the fluoroquinolones. Now if you take the fluoroquinolones in class 3, these include Levofloxacin and as well as Moxifloxacin. Alright, Levofloxacin and as well as Moxifloxacin. So these are the class 3 agents. Then we have class 4 agents. Right, then we have class 4 agents. These class 4 agents, remember, they are oral bacteriostatic agents. Alright, these are oral bacteriostatic agents. These oral bacteriostatic agents, they include para-aminosalicylic acid, then we have cycloserine, and then we have another drug which is called as ethionamide. Right, then we have another drug which is called as ethionamide. So these are your class 4 drugs. Then we have class 5 agents. for MDR and as well as XDR tuberculosis. Remember, the class 5 agents are those drugs with uncertain efficacy, right? Drugs with uncertain, right? Drugs with uncertain efficacy. Now let me tell you the drugs. So the drugs in your class 5, they include linezolid, they include clofazimine, then you have amoxicillin plus clavulanic acid, and then you have clarithromycin, then you have imipenem, then you have thioacetazone, and next you have high dose isoniazid. So these are all your class 5 agents and they include the drugs with uncertain efficacy. So this is completely the treatment of the MDR and as well as XDR-TB. Now when you are selecting the drugs in extensive phase and as well as continuation phase, you have to follow the hierarchy from class 1 through class 5 agents. Now let me tell you what are the drugs in the extensive phase, what are the drugs in the continuation phase. So after discussing the classes, now let me tell you the guidelines. So what I have said you is like you need to maintain the hierarchy, like you have to select the group of drugs from class 1 through class 5. So if you take the points one by one, number 1, use any first line oral agent that may be effective, right? So use any first line oral agent alright, use any first line oral agent that may be effective. And the second group of drugs are what? They are the second class of drugs are the fluoroquinolones. So the second point is use a later generation right, use a later generation fluoroquinolone. Next, the third point is that you have to use an injectable agent to which strain is susceptible, right? Like we have the injectable agents like streptomycin, amikacin, capreomycin and as well as kanamycin. So the third point is you have to use the injectable agent right, you have to use the injectable agent to which strain is susceptible, right, to which strain is susceptible. So that is your third point. Next, the fourth point is that use a second line oral drug to which the patient is not exposed previously, right? So use a second line oral agent to which patient was not exposed right, patient was not exposed previously, that is D. Next, the last point is that you have to use the drugs with unclear efficacy, right, use the drugs with unclear efficacy, that is your class 5 drugs. So these are the guidelines what you have to follow for the treatment of MDR and as well as XDR tuberculosis. Next point, we will take an example. For example, if the bacteria is resistant to isoniazid and rifampin only. Now the combination is like, so the point is, for example, the Mycobacterium tuberculous organism is resistant to isoniazid and as well as rifampin, right, resistant to isoniazid and rifampin only. Then what are the drugs you have to give or you can give in the extensive phase and as well as continuation phase. Let me tell you. You take in case of extensive phase, the drugs what you can give in case of extensive phase is like 6-ZE, right? What does this 6 stands for? The extensive phase you have to give for nearly around 6 months. 6-ZE, Z stands for pyrazinamide, E is your ethambutol, plus Q, right? Q stands for what? The quinolone, right? So the first point is the first line oral agents, pyrazinamide and ethambutol, first line oral agents. The second thing is use a later generation quinolone, Q stands for quinolone. And what is the third thing? You have to use injectable agent. So plus there should be one injectable agent, right? There should be one injectable agent, and use second line oral agent where the patient was not exposed previously. So any drug, for example, you take para-amino-salicylic acid and use drug with unclear efficacy. Now we will take an example, that is cycloserine, right? Cycloserine. So remember, this particular entire combination you have to give it in the extensive phase, right? You have to give this in the extensive phase. Alright, you have to give this in the extensive phase. Next, now in case of continuation phase, injectable drug and as well as the pyrazinamide, that is removed, and the rest 4 drugs are continued for a minimum of 18 months in the continuation phase. So now if you take the continuation phase, this includes 18E in the sense 18 months the individual has to use ethambutol and as well as the remaining combination. So 18E plus Q plus para-amino-salicylic acid plus cycloserine. So these are the drugs what you use in the continuation phase, right? These are the drugs what you use in the continuation phase. So remember this point, the injectable drugs and the pyrazinamide is removed in the continuation phase. The remaining drugs like ethambutol, quinolone, para-amino-salicylic acid and cycloserine is used in the continuation phase, right? So these are the guidelines what you have to follow for the treatment of multi-drug resistant tuberculosis and as well as extended drug resistant tuberculosis. Next, now after having discussed about MDR-TB and as well as XDR-TB, I want to tell you some of the very important points regarding the anti-tubercular drugs. The points are, you take ethambutol and as well as streptomycin, right? Ethambutol and as well as streptomycin, they do not cross the blood-brain barrier. Right? They do not cross the blood-brain barrier. Which one? Ethambutol and as well as the streptomycin. Next, the other point is the ethambutol and as well as the streptomycin, both of these drugs are not hepatotoxic in the first line drugs. Alright, they are not hepatotoxic among the first line drugs. The other important point is, you take ethambutol and as well as pyrazinamide. Ethambutol and as well as the pyrazinamide are the drugs which can cause hyperuricemia, right? They are the drugs which can cause hyperuricemia, right? They increase the uric acid level. Now, the drug which is safest in renal failure is your rifampin. So if you take rifampin, remember it is safe in renal failure. Next, now there is one drug which is contraindicated in pregnancy, right? A first line anti-tubercular drug contraindicated in pregnancy. So remember, you take your streptomycin. Streptomycin is contraindicated in pregnancy. right? Streptomycin is contraindicated in pregnancy. So these are some of the important points regarding all your anti-tubercular drugs. So remember, ethambutol and as well as streptomycin, they do not cross the blood-brain barrier. Ethambutol and streptomycin, they are not hepatotoxic among the first line drugs. Ethambutol and pyrazinamide, they are the drugs which can cause hyperuricemia. And rifampin is the safest drug in renal failure. And streptomycin is contraindicated in pregnancy. So this is completely about the discussion on the anti-tubercular drugs.